Good morning. I'm Michelle Levander, Director of the USC Annenberg Center for Health Journalism. Thanks for joining us today for our Health Matters webinar, After Obamacare, the Future of U.S. Healthcare, offered thanks to a generous grant from the National Institute of Healthcare Management Foundation. President Trump made dismantling Obamacare a centerpiece of his election campaign. Now he and Republican congressional leaders are taking the first steps to make that a reality. But with so many competing options before Congress and no plan yet announced by President Trump, how can journalists and policy thinkers best respond to this fast-changing situation? In this webinar, we'll discuss key ideas put forward in Republican proposals, how this political shift will change U.S. healthcare coverage, and the 20 million people insured through the Affordable Care Act, and what questions journalists should be asking as these dramatic changes unfold. Here to help equip reporters from media markets large and small, we have Jennifer Haberkorn, Senior Healthcare Reporter for Politico. We'll also be joined by Joseph Antos, the Wilson H. Taylor Scholar in Healthcare and Retirement Policy at the American Enterprise Institute. Dr. Antos is the former Assistant Director for Health and Human Services at the Congressional Budget Office, and he's generously stepping in for Dr. Lan-Hee Chen of the Hoover Institution, who couldn't join us today. We'll also be hearing from Jonathan Gruber, the Ford Professor of Economics at the Massachusetts Institute of Technology and an architect of both Massachusetts' ambitious healthcare reform effort and the Affordable Care Act, and he'll be sharing his perspectives as well. Before we get started, I wanted to share some details on our format. First, we'll hear from our three panelists, and then we'll take your questions at the end. We have more than 1,000 people signed up for this webinar, so we'll ask you to raise a virtual hand on your webinar dashboard and share your questions through the chat or question box. If you're having technical problems, you can also use the question or chat box on your control panel, and we'll try to respond and help you. Should you want to tweet about this webinar, we'll be using the hashtag TrumpCare2017, and we invite you to add to the conversation online. We'll also be recording and archiving our webinar. We're going to start out with Jennifer Haberkorn. Jennifer, can you provide us with some context on how to get our arms around this fast-moving story? Who are some of the players to watch, both in Washington and in the states? And what do you anticipate as upcoming flashpoints?
Hello, everybody. It's great to join you today, and I think Michelle will be able to, I don't know if we'll be able to answer all those questions, but at least hopefully provide some perspective and help in how to answer them. So one of the first things I wanted to talk about is kind of how this process is going to play out. If we look back, Donald Trump made a campaign pledge to repeal the Affordable Care Act, and congressional Republicans did as well, actually for many years and through many campaign cycles by now. And when the year started, and I guess I should go back and say that this slide is intentionally blank because we don't know exactly how this is going to play out. I mean, earlier this year, we thought we had a kind of roadmap that would look like congressional Republicans would start immediately with the process of repealing as much of Obamacare as they can through legislation, and then couple months later, they would start the process of debating a replacement. But already that process has changed dramatically. Rank and file Republicans on the Hill really balked at the idea of voting on repeal without a replacement. And so Republicans have already had to kind of scramble and come up with a different roadmap. Now it looks like the kind of broader process is going to be that lawmakers will repeal as much of the law as they can and enact new policies at approximately the same time. And I think that process is going to take many months. You know, just over the last couple of weeks, we've seen that they're already hitting road bumps, and this is going to be a lengthier process than we once thought. One thing to watch out for in particular is how much replacement is in this repeal effort. When repeal happens, it'll probably be one bill passed through this complicated Senate process called reconciliation, and they'll attach as much of replacement policy as they can. For instance, Republicans are saying that they're going to implement their health savings account replacement in a repeal bill. And And in that repeal bill, they want to include things like undermining the individual mandate and employer mandate, get rid of health savings account restrictions. It's unclear, however, how much of replacement they can actually attach to this process. And so one thing to watch out for is when Republicans say replacement, is there actually replacement in the bill? Because there's just some things, you know, if Republicans are talking about giving people some kind of tax help to help people buy insurance, is that really going to be able to be passed through this reconciliation process? And I guess all this is to say that the timeline in the process is really unpredictable, and at this point, we don't know exactly what it's going to look like. But we do know some of the things that Republicans really want in their health care plan. There's no public, at least, Trump health care plan at this point. There are several Republican plans. I'm going to include some links later if you want to take a look at some of the kind of leading Republican plans. But I've listed here some of the policies that are most likely to be in any Republican health care plan. And that's just based on consensus among Republicans and some of the things that are in the existing Republican plans from Tom Price, Donald Trump's HHS Secretary nominee, Paul Ryan, the House Speaker. And Donald Trump has spoken a little bit about all of these to some extent. I won't go through them all right now. I'm sure Joe will mention a little bit of these in his presentation. I don't want to steal from him. But I think there's some good story ideas in all of these policy lines. One that I wanted to talk about in particular is Medicaid. Republicans have proposed potentially block granting the Medicaid program. And as of now, their repeal bills include undoing the Medicaid expansion that was in the Affordable Care Act. And that's going to be interesting because there's many Republicans that chose to expand Medicaid under the ACA in their states. And I think we're already seeing Republican governors kind of push back on the idea of undoing the Medicaid expansion because they would have a very messy problem to deal with if Medicaid was undone. So if you live in a state or if you cover a state that does have a Republican governor that expanded Medicaid, I think it'd be really interesting to do some stories on, whether that governor is pushing back on Congress, pushing back on their congressional delegation, and trying to preserve the Medicaid expansion and Obamacare. And of all the things that Republicans really want to repeal in the ACA, I think this is one of the areas that they may at least initially rethink whether repeal is the best option right away. So I think that's fertile ground for story ideas. And the last one I wanted to mention as well is the pre-existing conditions policy in the Affordable Care Act. We've already heard a lot of Republicans saying that they want to preserve Obamacare's pre-existing condition policy. This is one of the most popular aspects of the healthcare law, and it basically says that insurers cannot deny you because you have a pre-existing healthcare condition. They also can't charge you more if you have a pre-existing healthcare condition. And because it's so popular, Republicans have had to get out front of accusations that they want to undo this policy. But what Republicans want to do is keep the idea that insurers can't deny you, but do the policy a little differently. We can get into that policy difference in questions if there's some interest there, but I think that might be an interesting story idea because it hits consumers, and there's going to be a lot of consumer interest in whether a Republican healthcare alternative is going to preserve Obamacare's protections there. And these are some links to some of the, this first link here is a Kaiser Health News analysis of the different Republican healthcare plans, and it really lists out all the kind of top line issues in each of the major healthcare plans, and it's a really great nonpartisan resource if you just want to figure out what these different policies are. The next link is to the House Republican Healthcare Plan. It was put together by Paul Ryan, and I think it's going to be a a blueprint that a Republican plan is likely to follow. And then I've included Tom Price's health care plan as well. Of course, he's the incoming HHS secretary. Assuming he is confirmed, a lot of folks assume that his plan will also be a blueprint for whatever Republicans ultimately put together. Also want to talk about some of the flashpoints that we're going to see, because I think in this process we're going to have such day-to-day changes that in the grand scheme of this repeal and replacement process might not mean much. And one of the problems I as a reporter have is, when is the point where you want to jump in and do a big story on one of these topics? Because there will be such granular changes. It may be hard to see when the big change or the big kind of moment to capture comes along. And as I'm thinking ahead, I'm thinking, when a major bill comes out or when there's actual policy. And we really don't have that yet, so it's been hard to kind of get at the policy details. Right now it's really just politics, and every time Donald Trump says something, he said little things about Medicaid over the last couple of days, and we've really wondered, does this mean he's making a policy position, or is it just kind of a political statement with not much behind it? But I do think regulations are going to be interesting to watch. The administration on Friday issued an executive order instructing the federal government to rescind, waive, or defer as much of the healthcare law as possible. Now, nothing actually happened in that order. There was no specific policy that was changing. But from a political standpoint, that was a clear sign that Trump not only wants to make a big political splash about repealing Obamacare, but it's putting pressure on the administration to do something specific and soon. Another kind of flashpoint to watch is whether a bill comes from the White House or from Congress. Just because Trump has not put out a very detailed healthcare plan, that's something that we're going to be looking out for. Or does it come more from the House Republican Better Way plan or Tom Price's plan? Also some players to watch. I think most of the action at the national stage will be in the Senate, because the vote tallies there are a little more narrow, and Democrats will be needed to get their votes on a replacement. In the House, Republicans have a broad majority, so they really don't need Democrats in the House. So if your state delegation has these members, I would look out for them. Republican moderates in the Senate, like Susan Collins, will be one to watch, because she'll have to be convinced to vote for this bill. And as of right now, she has kind of towed the line, kind of skeptical of the repeal effort so far. Also, Senate moderate Democrats like Joe Manchin, Heidi Heitkamp, their votes will be needed, or at least Republicans will really want their votes on a replacement plan, so they'll be good folks to watch. So I think I'm going to wrap up there and turn it back over to Michelle, and I look forward to answering any questions.
Thank you so much, Jennifer. Joe, we'll turn to you now. Can you provide us some perspective into the Republican critique of the Affordable Care Act and how some of the plans floating around in Congress might or might not be a fix?
Okay, great. Well, thanks, Michelle and Jen. That was a great summary. Probably told us more than we can possibly actually know at this point, but that's the way it seems to work these days. I think for the people who've called in, just want to clarify that reconciliation bills can only contain provisions that directly affect the federal budget, either spending increase or decrease, or revenues increase or decrease. And so, in particular, the reconciliation bill cannot be a vehicle for changing the insurance regulations, for example. The reconciliation bill that was pushed forward last year, Republicans knew that it was going to be vetoed. It is not a good guide to what the reconciliation will be this year. But it did include something that has been mischaracterized as repealing or not enforcing individual mandate. And in fact, what it did was all that it could do, which was to repeal the penalty for the mandate, but left the legal requirement alone, just took away the enforcement mechanism to the extent that penalty was an enforcement mechanism. So, there will have to be a separate bill that doesn't run through the reconciliation process to make major changes in insurance rules or many other things associated with the ACA. Okay, that said, Republicans' problem is that they have probably too many plans and not a single plan, and not just the Better Way plan, not just Tom Price's plan, but there have been bills from senior Republicans in the House and the Senate over the last 6 or 7 years. They all have similar themes. They all start off by saying repeal Obamacare. That's the last time I'll say Obamacare. I prefer to call it the ACA. And then after that, they have provisions that essentially alter some of the major aspects of the ACA that I think politically and in other ways are not going to go anywhere. So the idea, for example, of giving people organized choices does not have to run through a federal government website, but certainly organized choices, or any government website. It could be operated through private organizations. But the idea of giving people choices is obviously in there. The idea of subsidizing people who are buying insurance on their own in the individual market is going to be there. The confusing part is, of course, what about all of those details? So I thought I'd mention a few of those details. In particular, one thing that Jen did not mention is Medicare. So I thought I'd dispose of that quickly. As I think everyone knows, Paul Ryan has been a staunch supporter of premium support. He's had that when he was the chairman of the House Budget Committee. He had that in each of his budget resolutions over several years. It's also in the Better Way plan. However, Donald Trump, acting as the politician that he truly is, said that he didn't want anybody to touch Medicare. That has been repeated since then. The idea that there's going to be a sudden shift to premium support, I think, is wrong, but much more likely, and this is something that I think reporters might look for, is some reform of the Medicare Advantage program to make that a more competitive program, to have the bidding process work better so that fee-for-service Medicare is an active bidder in that process, in a sense, possibly changing the default. When you turn 65, right now the default is that you're automatically enrolled in traditional Medicare unless you choose a MA plan, but that might change to having anybody who turns 65 having to make a concrete choice rather than have a default, this default approach. With changes in the Medicare Advantage program, you have kind of a gentle transition to a premium support idea. Essentially, MA is premium support. It's a fixed subsidy for Medicare beneficiaries, and putting it on a more budgeted system rather than supporting fee-for-service approaches that promote higher volumes of treatment, even when it's unnecessary, although it might well be profitable for the health industry. So if somebody would put themselves on mute, I would really appreciate it. They're typing. So anyway, so that's Medicare. So look for some modifications in the MA program over as possibly as part of the replace bill that I think has to inevitably be separated from the repeal bill that will run through reconciliation. A little bit about timing. The budget resolution said that the committees had to report a repeal bill out by Thursday. Don't worry about covering that, but I think Dr. Price said in a hearing recently that he was looking forward to seeing a repeal bill sometime in late February or early March, which I think is probably as fast as it could possibly occur. And that may not have accounted fully for the Senate, the strong Senate view that you had to have repeal and replace run along at pretty much at the same time. Let's see, other aspects of what could be in the replace bill or the repeal bill. One of the things that Republicans desperately have to come to grips with is the instability of the individual insurance market. Now, this was created by the ACA. Let's be clear about that. Democrats wanting to do what they felt was the right thing forgot that insurance is a business in this country. And so by requiring a guaranteed issue, by requiring that insurance companies have to charge the same premiums to everyone, regardless of their likely use of healthcare services, and having a mandate that was very, very weakly enforced and really delayed, so that in essence there was no mandate for the first year, because the definition of is there a mandate or is there an issue that I care about is, for most Americans, they ask their neighbors, do you know anything about it? The answer in 2014 was no. You know, you have a situation where the government has not taken action to drive people into the individual market, into the exchange plans, but the insurance companies basically have to take on all comers. That guarantees adverse selection. That guarantees that you get a heavy concentration of people who have immediate health needs, often expensive health needs, and very limited participation by people who are younger and healthier. On top of that, the ACA included the under 26 provision. Regrettably, Donald Trump says he wants to keep it. It was a giveaway to the middle class. But the single largest segment of young, healthy people is, of course, people under 26. And their parents were likely going to pay their premiums for them. So in fact, that's another barrier. So what are Republicans going to do? Well, Republicans have to get off of some of their own policies as well. In particular, they have been against reimbursing insurance companies for the requirement that low-income people below 250% of poverty in the exchanges get a subsidy for their cost sharing. Cost sharing, again, is deductibles and co-payments, that sort of thing. They can't eliminate through reconciliation the requirement that insurance companies do this, but they would have to appropriate the money. And the most meaningful thing they can do to stabilize the market is, in fact, to appropriate that money. They don't necessarily have to call it an appropriation for cost-sharing subsidies. They could create a new program in the reconciliation bill, in the repeal bill, and with very limited requirements on insurance companies that basically, at least for this year, make the insurance companies who are in the exchanges somewhat whole, given that this is what they were assuming was going to happen, and that's how they set their premiums for the year. If they don't do that, that's a very strong negative signal, which will make it very difficult to keep insurers in many of the exchange markets, and will make it impossible for Republicans to make good on their promise to give people more choices rather than fewer choices. Now, on the question of reducing cost, Democrats had the easy part of it. Anybody can spend taxpayer dollars to expand coverage, but reducing cost is the really hard issue. The ACA really didn't address that very much. The Innovation Center started a bunch of demonstration projects, but they really haven't gotten very far. And the reason is this is a very difficult problem to try to solve, but the Republicans have raised their hands and volunteered to do it. I think the angle is not going to be for the government to create new business enterprises for providers to sign up for. I think the angle is going to be to change the nature of compensation so that providers and providers are more willing to take on risk. Insurance companies are more willing to bargain hard with hospitals and doctors, and that those two entities realize that their customers are actually the patients and the consumers, not the federal government. That's been a problem all along. The main criticism that I think of the ACA, and then I'll stop, the main criticism that I think got Donald Trump elected, at least if it had anything to do with the ACA, really wasn't the details of the ACA. The slogan was repeal Obamacare, not repeal subsidized health insurance, not repeal choice, not repeal whatever kind of nice warm thing that you can say about the intentions of the ACA. So this was a reaction, I think, not to the details of the ACA, but really more to a general angst and a concern that this is a country where one's children, especially if you're a lower income person, maybe even a middle income person, you're worried about your kid's future. And I think that's what this was all about. So if that's the case, if that's what the Trump team believes, and I think they do believe that, then they're not going to be too concerned about this debate that was going on among Republicans on the Hill about whether it had to be a full repeal or not. I think the Trump people are going to be more pragmatic about it. That said, I would not expect to see the Better Way plan implemented in any substantial way. The Better Way plan was a campaign document. It was not a detailed plan. Similarly, Tom Price's proposal, that was a proposal that he's sent up and had die in the House 3 or 4 years in a row. That was a bill that he knew was not going to get passed under Barack Obama. So I think the burden is going to be on the Obama White House to give direction to Republicans, to be more clear, probably not publicly, probably privately, about what they're willing to accept, what they're willing to push for. And that's going to be a real challenge for reporters. One last little point, and that has to do with the executive order. I think reporters should look at the limitations of anything you could do through executive orders or through executive action without going through Congress. Partly, as you know, the executive order said that any changes have to obey the law. That's the first barrier. Other barriers that are not mentioned there, but another barrier is that the executive branch, the new Trump people, have to specify what they're interested in, and that hasn't happened yet. Third, you cannot expect career people who've spent the last 6 to 8 years implementing one policy to turn on a dime. They won't do it, and they will not take credit or blame for any changes. So you need Tom Price, you need Seema Verma, and you need several layers down within the department and within CMS of appointees who are prepared to show leadership and are knowledgeable about what the options are. If you do that, then you may have some movement on some things that could change this year. But the reality is that the exchange plans are not going to change this year because there are probably 10 or 11 million people who signed up for the exchange plans, and it's impossible to make those changes. Furthermore, any change that would affect the insurance benefit has to go through the states. Every state changed their laws to be compatible with the ACA. So they're going to have to change the laws.
Joe, this is such a helpful overview. We're going to turn now to Dr. Gruber. Dr. Gruber, you played a critical role in bringing the ACA to life. What are some ways that Republicans can repair it rather than dismantle it that could preserve the most important pillars of Obamacare?
Thanks so much for having me. It's great to be here, and it's great to follow Joe, who is, in my opinion, one of the very few reasonable voices on the right on this topic, and laid out things super clearly. I think I'd like to start with a controversial statement, which is the ACA is not a failure. The ACA is a massive success. And if you look at what the ACA has done, it's accomplished its goals. So what would the ACA had 3 goals. The first goal was to increase insurance coverage. Insurance coverage has gone up by about 20 million people. The second goal was to stabilize a broken insurance market. Everyone talks about how quickly premiums have risen in the individual insurance market since Obamacare, but actually they've risen more slowly than they rose in the 3 years before the Affordable Care Act. The market's actually more stable. It's a place where finally individuals cannot be denied insurance because they're sick or have a pre-existing condition. We've actually finally joined the League of Developed Nations in being a nation where we do not allow insurers to discriminate and turn down people just because they're sick. And that's a fundamental accomplishment that cannot be understated. And finally, while Joe's right, there hasn't been nearly the movement on cost control we might have hoped. There's been real progress on cost control. Employer-sponsored premiums have fallen by $3,600 relative to what was projected for this period of time. Now, is that all the ACA? No, it's not all the ACA. Is it part of the ACA? I would argue it is. Things like the readmissions penalty and other innovations have had real effects which matter. So I think we sort of, this sort of line has become, so the ACA is a failure, what do we do instead? The ACA is not a failure. The ACA has been enormous success substantively. The only failure, and Joe hinted at this, the failure is political. The failure is not substantive. On policy grounds, it's been a huge success. The failure has been political. And that's what led to the opposition in the campaign and put the Republicans really in the box they're in right now, which is, you know, it's been said before, they're the dog that caught the car. They've been chasing this car and barking after it for 8 years, and now, 6 years, and now they've got to caught the car, and suddenly they realize it's kind of hard to do something. They're fundamentally, and Joe's emphasized this, there is no replace that's realistic. Any replace has been a political document that's been laid out to get votes and to stake out positions, not to actually replace the law. And, you know, that's because, let's be honest, Obamacare was the replace. Obamacare was developed originally with Romneycare, and that was originally a plan from the Heritage Foundation developed to be an alternative to the original Democratic plans of the Clinton administration. There is nothing, literally nothing, more conservative than Obamacare that can cover as many people without spending more money. If you're going to move to the right, you're either going to cover fewer people or you're going to spend more money. That's a simple mathematical rule. There's nothing else you can do there. And basically, Republicans are in a huge box because essentially, let's step back to the fundamental principle of what insurance is. Insurance is driven by the 80-20 rule. It's driven by the fact that 80% of the spending is done by the 20% sickest individuals. That means that insurance, by necessity, involves redistribution. It involves some way of reimbursing some entity for covering the cost of the sick, because the sick can't cover all their costs. Now, one entity that does that, say in Canada, is the federal government, but that's not in the cards in the U.S. Okay? The question is, how do you get there? So what Obamacare did was it said, look, we're going to essentially have the risk-bearing entity be the insurance companies. We'll essentially say insurance companies will bear the risk for the sick, but we're going to help them in 4 ways to bear that risk. The first way is we're going to expand Medicaid, which is going to pull many of the sickest people out of the insurance pool, since lower-income people are sicker, so they don't have to cover them. The second way we will deal with covering the sick is we will have tax credits that promote healthy people to come into the pool. That's the carrot. The third way is we'll have a mandate penalty that penalizes healthy people that don't come into the pool. That's the stick. And then finally, the fourth way is we will essentially pay money to insurers through reinsurance payments to help offset the costs of the sick. So essentially what the Affordable Care Act did was bring four tools together to try to promote the ability of private insurers to deal with the fundamental law of insurance. Here's the problems Republicans face. They have been outspoken opponents of every one of these four mechanisms. They've opposed the Medicaid expansions. They've opposed the tax credits in the form they are. We'll come back to that. They've opposed the mandate, and they've explicitly opposed, and in fact would not fund, the funds to insurers to allow them to reinsure the risks of those in the pool. So either Republicans have to break a strong policy position they've taken, or there is no, or the thing falls apart. Okay. Now, the one place where they've been in agreement is tax credits, but let's drill down on that a little bit, because Republican tax credits are not as helpful as the Obamacare tax credits, and that's because Republican tax credits are fixed amounts that do not vary with income. A key insight of Obamacare was that we need tax credits that vary with income to make health insurance affordable. Okay, but if under the Republican plans, as Joe said, they're just sort of notional plans. But for example, they'd say a 60-year-old will get a $3,000 tax credit or a $4,000 tax credit, whatever. Well, if you're a 60-year-old in New York and insurance is $8,000 and your income is $10,000 a year, you can't afford insurance. That's just not going to work. So in some sense, they fundamentally have not dealt with the affordability. So essentially, what has to happen, really, if Republicans are serious about replacing this, is one of two things. One, they cannot replace it. They can say, look, we're just going to repeal. We're going to go back to the old world where the sick can be discriminated against, and we'll just live with 20+ million more uninsured. I would not rule that out as quickly as other people on this call are ruling that out. I hope it's wrong. I hope they won't. But when it becomes apparent how hard replace is, I'm unfortunately not as willing to rule that out. The second thing is they can cave on principles they've already stated. So, for example, one thing they could do is they could say we're going to repeal, but we're going to throw a whole bunch of money at insurance companies, that fourth channel I talked about. Despite the fact we opposed it before, we'll just throw a whole bunch of money at insurance companies to bribe them to stay in the exchanges. That would be one approach they could take. But basically, unless they're willing to back off on one of the principles that they've already stated, then there is no replace, and there is no real alternative. And I think that what is very important for the people on this call who are journalists and who want to understand this is to just not let people who have sort of false replace plans deny this fundamental mathematics. The mathematics of insurance is clear. Okay, the mathematics is someone has to pay for the sick, and Obamacare set up a balanced way, in my opinion, of doing that. If Republicans have a plan for an alternative way, then let them own the cost of that. So I'll just close on one example. Actually, two things. Well, let me close on ACA in one example, which is you hear Republicans talking about high-risk pools, saying, well, this will solve our problem. We'll have high-risk pools. Well, a high-risk pool is essentially saying we will take the sick and segregate them, put them in their own pool. But the only way they can then afford insurance is if it's massively government subsidized. And by estimates I've done and I've seen, actually to try to solve this problem with high-risk pools would actually cost more than the ACA, because you have to throw so much money in those pools to make it affordable, you'd end up spending more money. So I think we have to hold people accountable. If there's going to be a credible alternative, we have to hold them accountable to the laws of insurance and mathematics in proposing that alternative. Let me just end on two quick things, because Joe had mentioned them as well, and Medicaid and Medicare. Medicaid block grants, let's be super clear on this. It's just an effort to cut Medicaid. Okay, they can talk about wanting to give states control, but states already have lots of control. States already have a huge amount of the skin in the game with the Medicaid program. States pay between 30 for the traditional Medicaid program. States pay between 35 and 50% of the cost of that Medicaid program. So states already have a huge amount of skin in the game. So really, Medicaid block grants is about a slow way to cut Medicaid. Now, I'm not saying that's wrong. I'm not saying that's not something we should consider, but we should be honest about what it is. It's not an effort to reorient and modernize the Medicaid program. It's an effort to cut it, and we just need to be honest about that. Then finally, on Medicare premium support, here's to me the ultimate irony. I cannot imagine a topic on which you could get more health economists on the right and left to agree than on some form of Medicare premium support. Well, maybe getting rid of the tax exclusion. We could talk about that. But Medicare premium support, Bill Clinton worked on it. you know, there are proposals from left of center, right of center people. It's actually something where, if done correctly, you could get broad support for it. The problem is, right now, Democrats know that uttering the word Medicare massively redounds to their benefit. And so I can't imagine Republicans, despite what Paul Ryan said over and over again, I can't imagine they would commit the political suicide of actually trying to seriously take on the Medicare program. It's too easy to be demonized for that. So let me stop there.
Thank you so much, Dr. Gruber, and I want to thank all three of you. We're now going to open this up to questions from our audience. And as I mentioned before, if you have a question, type it into the questions field in your control panel, and we'll read out some of the questions. We have more than 1,000 people signed up for this, and so we have to take your questions this way. I'm going to start out with a couple of early questions, but I also want to remind everybody that the hashtag for this webinar is TrumpCare2017, and we will be archiving webinar video as well. So he asks, how much do HSAs help most people? That is, does the tax deduction make a real difference in affordability for most Americans? He doesn't specify who he wants to answer that, so either.
I'm sorry, this is John Gruber. I'm sorry, could you just repeat the question?
Sure. He says, how much do HSAs help most people? That is, does the tax deduction make a real difference in affordability for most Americans?
Well, if this is John Gruber, I can jump in on that. I mean, look, HSAs don't matter for most Americans. They certainly don't matter for the uninsured. 50% of the uninsured don't pay taxes. 90% of the remainder of the uninsured who pay taxes pay a 10% tax rate. So HSAs, you know, which means that HSAs only subsidize health insurance by 10%. HSAs are, you know, we can debate them as a tool for the well-off, but they're not a solution for lower-income people. And I think that's just, once again, it's sort of a nice talking point that Republicans have used. The HSAs will provide more control to people for their health care spending, but they're really sort of irrelevant for the vast majority of low-income people that we're talking about being affected by Affordable Care Act repeal.
And this is Jen. I would just add to that. Oh, sorry if I interrupted someone there. I do think it's interesting that Republicans have focused a lot on HSAs. I think that's mostly because they agree with them politically. You know, all Republicans support the use of HSAs, so it's very easy for them to spotlight them as part of their replacement plan. But I think to John's point, they are not really, they shouldn't really be considered full extensive coverage.
Okay, so nobody's claiming that. John, you've overlooked the Medicaid program, and you've overlooked Indiana. So I think, at least on the basis of state waivers, I strongly suspect that there will be a number of states that will embrace an HSA type of an approach, along with some other reforms for Medicaid. And the point of this is not to somehow undercut the Medicaid benefit. It's to give people more of a sense that there are real resources that they can control and that they should care about. That's really the point of this. It's to make people aware that they're spending real money and it's theirs. So in fact, I think in the case of Medicaid, I think you will see again, on a state waiver basis, a number of states moving in that direction, along with some other requirements that I think are intended to encourage Medicaid beneficiaries to at least look for work and to use the healthcare system in a more responsible manner.
Yeah, Joe, if I can just jump in on that, I think the HSAs and Medicaid are total political cover, that they don't do anything, and that you have to remember, you can't ask someone who with $10,000 of income a year to have skin in the game when it comes to making major medical decisions. Their money all goes to food and shelter.
John, oh my goodness, John. It's just that some of the subsidy, instead of going directly to the doctors in the hospital, would go into the HSA. So, all right, fine, right. I agree with you. If people are really dead broke, then we're going to end up paying 100% of their costs. But we still want a more efficient system where the patient cares whether there are unnecessary tests, unnecessary visits to the highest cost healthcare setting rather than lower cost clinics. Yeah, we should care about that as citizens of this country.
And I totally agree with that. And I think for anyone who's, at a, maybe 2.5 or 3 times the poverty line where they have the kind of discretionary income when this matters or above, I think it's crazy. I've said repeatedly, Joe, I think it's crazy that people at our income level don't have more skin in the game when it comes to health care, but you just can't do it with someone with income at $10,000 a year. They just don't have the money.
I just want to make sure we get to everyone's questions. We have one from Regina Leonard, who has a question for Joe. She says, so we're thinking that we will try to go back to fee-for-service, even if measures and bundling works to lower costs. Did you want to reply to that?
She must be talking about Dr. Price's opposition to the mandatory nature of some of the innovation centers demonstration projects. That's interesting. Price did vote. He was a big cheerleader for MACRA, the bill that has been touted as shifting physician payment in Medicare towards value-based purchasing. We'll see if that really works out. I think that's going to be a problem. It would have been a problem for Hillary Clinton as well. But nonetheless, the idea that we're going to somehow move to pure fee-for-service, I think, is completely misreads everything that Republicans have said, and certainly most of what Tom Price has said over quite a few years. So no, we're not moving in that direction. I think the more sensible way to look at it is that payment systems, at least in the Medicare program, which is really where the government has control, will continue to move in the direction of promoting more sensible healthcare delivery and promoting systems where providers accept some financial risk and also can get some financial reward, and ideally payment on the basis of real outputs rather than inputs, which is the way it works now.
We also have a question from Liz Seger. She asks, and this is to everybody, and keep in mind for those of you who are listening, you can just type your question in the question panel and we'll take as many as we can here. She asks, what is your initial take on the plan unveiled by Senators Collins and Cassidy yesterday?
Well, I guess this is John. I guess I'll take a first crack at that. I mean, I think it's encouraging that people are thinking creatively, but I think that it really is just too light on details to know. So, for example, here's a big question. It seems to me the #1 priority of the Republican Congress on dealing with repeal is to get rid of the tax on the wealthiest Americans that provides about 1/4 of the financing for the ACA. If you get rid of that tax, you can't do this plan. So are they really committed to keeping all the ACA funding in place? Second, the ACA already has in place something called Section 1332 waivers, which allows states to innovate. And in fact, they could do pretty much what they could do under this proposal. The difference is there's a few national regulations this proposal will get rid of. But the big difference with Section 1332 is it requires that any state that innovates show that they're not going to lower insurance coverage below what the ACA created. I don't see any such sort of safeguard provision in this law. So I think my concern is it could lead to a large increase in uninsured.
2 points on this. One is that John is certainly right. It doesn't have a lot of detail. The point of these kinds of early proposals is to kind of put a political stake in the ground. But the reality is that any kind of a replace bill that Republicans come up with will be a matter of negotiation. First among Republicans, and then with some Democrats, because they're going to need some Democratic votes to get it through the Senate. So it's way too early to speculate about this. John is absolutely right about the flexibility that's already there in 1332, it's not as flexible as it could be. So Medicaid waivers are going to be required to be sensible. But as far as how flexible can it be? I think it'd be a lot more flexible than I think John is thinking, because after all, the requirements are judgments rather than facts, and so to grant a 1332 waiver, there are projections about what might happen rather than after the fact 5 years later, here's what happened. Those are projections. So I think there's going to be a lot more room for state experimentation than I think John is suggesting.
And we have a question from Ivanvecera, who asks, any thoughts on how states like California would cope with a Medicaid expansion repeal? Expansion will start. I don't, this last part doesn't make sense, but go ahead and we'd be interested in your replies to that.
Well, can I let me start. So Republicans have a real problem with Medicaid expansion repeal. Certainly the financial aspects. There are Republican governors who expanded, and so I would not expect to see either a repeal of the authority to expand or an immediate reduction in the enhanced matching rate, the enhanced payment to states for the repeal population. However, I think over time that enhanced match will be reduced, maybe over a 3 or 5 year period. However, along with that, I think will be the opportunity through waivers for states who want to try something different to try something different. And kind of an answer to John's previous comment about block grants, I think that the way you get states to try something different, such as a more budgeted approach, is to put your money up front. I think the accountants in every state government will say, no, we want to go to a system where we're actually at risk for higher costs. We want to make sure that the taxpayers in other states cover our waste and inefficiency. So I think we're going to see some real battles there, but I think the battleground will not be legislative. I think it'll be through waivers.
And adding on to what Joe said, I think this will be an interesting thing to watch, because if the Medicaid expansion were to go away, states will have to grapple with, do they try to restore that in some way, or do they, take the political hit that would come, even though the feds would be responsible for a repeal, the states would face some political repercussions, or at least the public might think it's the state's fault for getting rid of Medicaid. So I think that would be something interesting to watch. And along those lines, I think many states now are starting to take some actions in case there is repeal. We've seen some states try to restore, or I should say, restore in anticipation of repeal, some of the benefits, some of the consumer protections in Obamacare. So just something else to watch out for.
We have a question from Estelle Kendall, who says, can you expand on what may happen to those individuals with pre-existing conditions if and when Obamacare is repealed?
Well, I think that all depends on the details of how it's of how it's repealed. I think that the fact that Trump came out right away and labeled that one of his sort of 2 things he'd like to keep means that it's going to be pretty hard for a repeal to take that change away, and that's really the box that repeal folks are in, which is essentially the ACA is this 3-legged stool of kind of with one leg that people love, which is making insurance non-discriminatory, but the other 2 legs that need to support it, which is subsidies and the mandate. And the box Republicans are in is how do they keep the part people like without while getting rid of the part they don't. Let me just mention one other thing, because I think it's an important distinction. The pre-existing conditions clause has gotten all the attention, but it's not the important part. Okay, the important part is the community rating. The important part is the fact that insurers can't charge the sick more than the healthy. So basically, even if you keep the ban on pre-existing conditions but allow price discrimination, then you can still just keep the sick people out by charging them a fortune. Really what matters is this community rating, and that has not been discussed enough.
And Jennifer, let me ask you a question myself. I'm just wondering, we've talked a lot about things happening in Washington, D.C. But if you're a reporter in a regional market or a really local market, what strategies would you recommend for them in covering this?
I think there's a lot of stories that probably fall into a couple buckets. One will be some of the policy that, um, it's really a story that you can write anywhere, but grappling with some of these questions like what do they do instead of pre-existing conditions? What do they do on Medicaid? And then there's also some good political stories that probably vary from place to place, but I think you could write some of these stories almost anywhere. For instance, did your state expand Medicaid, and what is the governor doing to try to preserve that? I think both Republican and Democratic governors that expanded are probably lobbying Congress to preserve that. The congressional delegations, I think, in areas of the country where there are a lot of people who enrolled in the ACA, are those members of Congress, and again, if they're Republicans, are they getting pressure from constituents to keep the law? So I think those are the first things that come to mind. I think as this story develops, it's going to become a little more clear. I think right now, a lot of this is so, we're just trying to read Trump's tweets to come up with policy story ideas. But I think as the policy fleshes out a little bit more, it might be easier to write those stories, or at least, you have some real comparison between the ACA and whatever Republican plan comes about.
And, I wanted to ask both Jonathan Gruber and Joe Antos, do you have any thoughts for reporters who are looking at this from a more local perspective? Just things that, from your policy perch, you think, oh, that journalists miss this, and it's looking them right in the eye. What would you recommend in that regard?
So you're saying about from a local perspective, or just general topics?
It could be both, but if you had some ideas for somebody who's like at the Miami Herald or at the Buffalo News,
okay.
But it could also be broader topics that would be relevant for someone in Washington.
I think that really from the local perspective, the real hard work is getting to the numbers of who wins and who loses under different proposals, and to really now, before the replace plans come out, to invest in building that knowledge base on who are the people who are going to be affected from alternative different policies, and getting some perspective on that, because I think there's just not a broad enough understanding in the public of how the different policies will affect different populations.
I suppose so. I think part of the problem is, though, that you have to work off of what actually happened under the ACA as opposed to the theory. So the word affordable, for example, is not affordable. Just because you have some nominal health insurance, this is a problem for Republicans too, but just because you have health insurance doesn't necessarily mean you have access to appropriate care. I think there's way too much emphasis on these aspects, and not enough on how is care being delivered in the local communities. And in particular, since the ACA was never intended to cover everybody, undocumented immigrants were specifically excluded, and other groups. So there was always going to be, even at its best, 10 or 12 million people without health insurance. Those are still people who are going to be accessing health care in some probably episodic way. And so I would look at those people, because they're if you want forgotten people, they were forgotten by Democrats and Republicans.
Well, actually, this feeds into what I would say is the final question, because we've run out of time. This is from Anthony, I think his name is pronounced Galas, who asks, are there any Republican proposals to preserve or improve public health spending, particularly for disadvantaged communities?
Yeah, I think public health spending has been the odd subject out in this context. The Affordable Care Act set up this big public health spending really slush fund, to be honest, and that's been repeatedly raided. I don't even know if anything's left. Maybe Joe knows, to fund various initiatives. I think neither side seems very focused, other than giving it lip service, on really doing much on public health funding.
Yeah, that's exactly right, because it's hard to specifically find a voter who knows they benefited from it. Yeah, this is a general issue. If you broaden public health spending to also include collecting information about what's actually going on, and I'm thinking about, for example, the surveys that the federal government runs that are the basis for making some judgments about how policies might work in the future. I think there's a real risk there too. It's not just providing health services in local clinics, but it's also this other infrastructure to policy that matters, and I think that's a concern of mine.
Jennifer, did you have any thoughts on that one?
Yeah, I guess I would just add that, Republicans in general were really skeptical of the Prevention and Public Health Fund, calling it a slush fund and saying that there was not enough oversight to it. So I would be really surprised if any Republican plan put even more money into something similar. And I should add that most of the Republican plans so far are not that detailed to actual dollar amounts. So we have not seen anything like that.
Well, so I want to thank all three of you. This has been a really vibrant and fascinating discussion. For all of our listeners, I want you to know that you will be getting a short survey about this webinar and also some of your interests in future webinars, and we'll be archiving PowerPoint and the entire video a little later today, and we'll send you an email about that. Thank you all so very much, and have a good afternoon.